Now we'll start with the shoulder or rotator cuff. So you can see this diagram. This is actually a shoulder or musculocutaneous cuff. So mainly it's a fibrous sheet. It's formed by 4 flattened tendons. So what are those 4 tendons? We'll find out. Actually these 4 tendons will blend with the capsule of the shoulder joint. You see this is a shoulder joint. It's mentioned here. It's a glenoid cavity, and this is a glenoid labrum. You know, this glenoid cavity of the scapula will articulate with the head of the humerus and form the shoulder joint, right? So to strengthen this shoulder joint, these are the 4 muscle tendons which are flattened and form a sheet-like structure, right? So these muscles only form the cuff, and this arises mainly from the scapula. All these muscles are arising from the scapula, and in turn they are inserted into the lesser and greater tubercles of humerus. So by this clue all you can understand, they are saying they are inserting into the lesser and greater tubercle. In the before video, if you see the muscles of scapula, then you know the muscles which attach to the greater tubercle are nothing but supraspinatus, infraspinatus, teres minor. Done. These are attaching to the greater tubercle. Then what are the muscles which will attach to the lesser tubercle? The muscles which attach to the lesser tubercle are mainly subscapularis, right? So these are the 4 muscles which are going to form the tendons around them. So you can see the supraspinatus muscle, the infraspinatus muscle, the teres minor muscle, and the subscapular muscle. So if you see, these all muscles tendons are present while crossing the shoulder joint. They become flattened and blend with each other on one hand and with the capsule of joint on the other hand. So before reaching the points of insertion. So the cuff gives the strength to the capsule of the shoulder joint all around except inferiorly. If you see, it's present all around but not present inferiorly. So this is the reason why the dislocation of humerus is always most common inferiorly in the downward direction. So by this you have understood the musculocutaneous cuff of the shoulder joint. So next we will discuss about the subacromial bursa. So this is the subacromial bursa. It's actually the largest bursa of the body. It's situated below the coracoacromial arch. So you can see this is the acromion process, and of course here will be the coracoid, right? So it is below the coracoacromial arch and the deltoid muscle. The deltoid muscle also will be above, right guys? So below the deltoid muscle and below the coracoacromial arch you will find the subacromial bursa, and this is the largest bursa of the body, right? And below the bursa there are tendon of supraspinatus and greater tubercle of humerus. So actually below this subacromial bursa passes the tendon of supraspinatus, and also you will find the greater tubercle of humerus, right? This is the greater tubercle of humerus. The subacromial bursa is of great value mainly for abduction of the arm. For the abduction of the arm, mainly it's of great value at the shoulder joint. So actually this diagram is better to explain. You can see this is the subacromial bursa, which is below the deltoid and coracoacromial arch, and below the subacromial bursa you will find out the supraspinatus tendon, right? So actually this subacromial bursa protects this supraspinatus tendon from the friction. Mainly it protects from the friction with the acromion, and also during overhead abduction the greater tubercle passes under the acromion process, and this is mainly facilitated by presence of this subacromial bursa. So now we'll start to understand even the intermuscular spaces. So the intermuscular spaces are mainly 3 in number. So as you can see here, this is quadrangular space, this is the upper triangular space, and this is the lower triangular space. So like this you will find the 3 intermuscular spaces mainly in the scapular region. So the quadrangular space, this is the quadrangular space. The boundaries of quadrangular space are superiorly you will see the subscapularis in front. So actually this is subscapularis muscle, right? So superiorly you will see the subscapularis in front, and also in superiorly you will see the capsule of shoulder joint, right? Here is the capsule of shoulder joint, and you will see teres minor behind. So this is the teres minor, you will see it behind. And inferiorly you will see the teres major muscle. This is the teres major muscle, right? So inferiorly you will see the teres major muscle, and medially you will see long head of triceps brachii. So this is medial. Medially you will see long head of triceps brachii, right? And laterally you will see the surgical neck of humerus. So you can see laterally this is the surgical neck area of the humerus. So these are the boundaries of the quadrangular space. Next we'll see what are the contents of this quadrangular space. So if we come to the contents, mainly the axillary nerve passes. Why axillary nerve? Because axillary nerve winds around the surgical neck of humerus. So the axillary nerve and also posterior circumflex humeral vessels, they also wind around the surgical neck. So these are the two contents of the quadrangular space. Now we'll discuss about the upper triangular space. So upper triangular space boundaries are: medially it will have teres minor, right? Medially it will have teres minor. Laterally it will have long head of triceps brachii. This is lateral, right? Laterally it will have long head of triceps brachii. Medially it will have teres minor, right? And inferiorly it will have the teres major. So just what you need to do to understand this diagram, just draw the three muscles. First you need to draw teres minor, right? Next you need to draw triceps brachii, long head, right? Next lower you need to draw teres major. So to remember in order, first draw teres minor, next teres major, next draw the long head of triceps brachii. That's it. Then the three spaces will form. First is the upper triangular space, next is the quadrangular space, next is the lower triangular space. So this upper triangular space contents are mainly circumflex scapular artery, because it's near to scapula, right? So circumflex scapular artery, and it interrupts the origin of teres minor and reaches the infraspinous fossa for anastomosis with the suprascapular artery. So about the anastomosis of scapula we'll see in another video, then you will find out this. And coming to the lower triangular space, medially you will have the long head of triceps brachii, medially this side. Medially you will have long head of triceps brachii, laterally you will have medial border of humerus, and superiorly you will have the teres major. So once again let us revise, recall. So now let us recall all these spaces once again. So first one is a quadrangular space. Quadrangular space, superior you will have the teres minor, right? And inferiorly you will have the teres major. Medially you will have the long head of triceps brachii. Laterally you will have the surgical neck of humerus. And the contents are axillary nerve and posterior circumflex humeral vessels, right? Next coming to the upper triangular space. Upper triangular space, medially you will have the teres minor. Laterally you will have the long head of triceps brachii. Inferiorly you will have the teres major. So what are the contents? The circumflex scapular artery, and it's interrupting the origin of teres minor, reaching the infraspinous fossa for anastomosis with the suprascapular artery. Next coming to the lower triangular space. Lower triangular space, medially you will have the long head of triceps brachii. Laterally you will have the medial border of humerus. Superiorly you will have the teres major. What are the contents of the lower triangular space? The radial nerve, because the radial nerve is towards medial side of the humerus, right? So the radial nerve and also profunda brachii vessels pass through it. So that's it. We have completed the intermuscular spaces also. So in this video we totally covered the rotator cuff muscles. What are the four tendons, right, which are inserting mainly into the greater tubercle and lesser tubercle of the humerus, right? And we discuss the subacromial bursa, and now we discuss the intermuscular spaces. Those are three spaces: the quadrangular space, upper triangular space, and lower triangular space. Mainly remember the three muscles: teres minor, teres major, and the long head of triceps brachii, and also the humerus bone. That's it. So by this we have completed this topic. Next we'll start with axilla or circumflex artery.